Why is it important for the patient to come in, let's say, 3 times a week? A patient may have considerations about that. Oh, I have a busy schedule at work, I have this, I have that. But do you provide them with a good enough understanding so that they really understand why they must come 3 times a week or 2 times a week or 4 times a week, whatever the recommended frequency should be, based on your clinical evaluation and best practices of patient care for this specific pathology. So perhaps that's the time to discuss with them what happens to soft tissue when you gain, let's say, 20 degrees in range in one session. If you don't get another session, let's say, in a appropriate time, within a day or two, what will happen to that tissue? So those are some things that you will need really to discuss directly with the patient so that the patient gets into an understanding. And then make an agreement with the patient. Agree in the room with the patient about what their treatment plan is and what the frequency of treatment is, and explain to them why they should not miss an appointment. And this is written, at least in our office, in the form of an agreement where the patient signs and we sign. Okay? So, and then there is a very important step. This important step is I would say, what has created a huge impact in our very successful right now cancellation and no-show rate. Our percentage of arrivals is very high, in the neighborhood of 97%, sometimes 98%. And this is the concept of public announcement. So I have a little video that I have created that I will show you right now with a mock-up patient so that you can get the idea of how the public announcement concept is taking place. Now, in the video you're going to watch, I am using the public announcement not only for physical therapy, I'm using the public announcement also for diagnostic testing that we provide to the patients. But in your practice, just take the same concept of the public announcement and apply it for the physical therapy treatments, okay? So let's watch this quick video. Okay, Mrs. Smith, based on the results of my physical examination to you, and also based on the assessment questionnaire that you filled out, I will develop now a preliminary treatment plan for you. And I will also have you do a quick nerve test and also a quick ultrasound, like taking a picture of your nerves, so that we can get some specific results from these diagnostic tests and create a more precise, more appropriate treatment plan for you. After the patient is being informed and agrees to the treatment as well as to the diagnostic testing, then a very important component is going to take place. You literally take that patient from the room and you walk that patient to the front desk. You're not just telling the patient, you go now and schedule your appointments. You are actually taking that patient and you are walking them as the treating provider to the front desk. And at the front desk, you make what is called a public announcement. All right, so Tula, this is Mrs. Smith. She's going to be coming for physical therapy 3 times a week. and she needs an EMG and an ultrasound in the next testing session, okay? All right, please schedule care. Good to meet you, Mrs. Smith.
Thank you.
All right, take care. You see, the agreement that you made with a patient about treatment 2 days a week, 3 days a week, whatever, or them receiving diagnostic testing, EMG, ultrasound, or whatever, is an agreement that you made with the patient. And an agreement of this kind is not as strong as it is a public announcement. So the definition of a public announcement is something known to more than two people. So with the secretary now, you are announcing with the patient next to you to the secretary that this patient will be receiving treatment for so many days a week, plus they will be getting their diagnostic testing done on a specific day. So that provides you with a much greater control on the patient case.